Let's talk about ovarian cancer.
What I feel is a lot of people are confused regarding what an ovary is, what is cervix and uterus and everything. Ovarian cancer is one of the rarest forms of cancer when concerned with these all in combination. So the symptoms of ovarian cancer are bloating, pain in abdomen, maybe change in her menstrual cycles. Ovarian cancer, unfortunately, is a cancer which gets detected very late.
Even if it gets detected later stage, okay. So what is the survival rate for the patient? Hello everyone, welcome back to another episode of In a Swank Way. As today is Ovarian Cancer Awareness Day, we are going to discuss more about it as there is very less information about this particular topic. Dr. Tushna Menon, she is obstetrician and gynecologist having more than 14 years of experience. She has also discussed Decoding Women's Health, a guide to men in another episode of ours. But yes, today we are going to have a detailed conversation about ovarian cancer, its symptoms, treatment and how we can support people who are suffering from this. So let's begin. Tushna.
Hi Tushar.
Yeah, welcome back.
Thank you.
Let's talk about ovarian cancer. Just help us understand what it is and how to understand better.
So before we start about ovarian cancer, can I just explain a little bit about what an ovary is?
Of course.
Right? So ovary is also a gland in our body, like a female organ in our body, which the main role of the ovary is to produce eggs.
Right.
Which helps a woman remain fertile and also produce female hormones like the progesterone and estrogen. Okay, so they are small, they are 2 in number, and they are located right next to the ovary near the uterus and the fallopian tube, and they are small white almond shaped glands. Okay, so when you're talking about cancer of the ovary, you're actually talking about cancer of these 2 small glands, egg producing, hormone producing glands in the female body. Okay. Now the whole female reproductive system is made up of the uterus, the tubes, the ovaries, the cervix, the vagina, the vulva, right, to put it in whole. Ovarian cancer is one of the rarest forms of cancer when concerned with these all in combination.
I think it ranks 5th
Correct.
overall, right?
Correct. Overall it ranks around 5th in female cancers. Right, but ovarian cancer unfortunately is a cancer which gets detected very late. Okay, so like ovarian cancer, the person doesn't walk into your clinic and say कि शायद मुझे ovarian cancer है. It doesn't happen. The symptoms the woman comes to you with are also very vague symptoms. So the symptoms of ovarian cancer are bloating, pain in abdomen, maybe change in her menstrual cycles, increased frequency in micturition, that is urination. So these are all very vague symptoms. Even if a woman does walk into a OPD for a medical or a gynac doctor, the first thing that's going to come to your mind is not ovarian cancer when she gives you these symptoms.
Because these symptoms are really generic also.
Exactly, they're very generic symptoms. You're going to try and rule out other issues, other problems before you as a doctor also think about ovarian cancer. Unless she comes to you with a strong positive family history of ovarian cancer or any other female reproductive cancers in the family, if she herself is a cancer survivor, okay, then if any cancer survivor walks into your clinic, you do think of cancer as one of your priorities and diagnosis for any symptoms. You do try and rule it out first.
Right.
And because ovarian cancer gets detected late, unfortunately that is the reason ovarian cancer has a very high morbid and mortality rate.
Right.
Yeah.
Okay, those chances are really high
in comparison to other cancers, yes, because it gets detected late,
very
right?
late.
It's just like a ratio.
Right. And just now you spoke about genetics. So
Right.
does this get passed on?
Ovarian cancer can be genetically related, but not much. So you can have the BRCA1, BRCA2 gene, which is also a breast cancer related gene, which can lead to causing ovarian cancer. But the association is not very high. So I would say 10% or 20%, if I'm not wrong, maximum of ovarian cancers could be genetic related.
Okay.
Most of the ovarian cancers are just on their own, unfortunately, because of genetic mutation, of course. But um,
So any habits that leads to this cancer?
not habits as such, but there are certain. So there are no causable factors. There is no nothing like point 1, 2, 3 can lead to ovarian cancer. So if you avoid 1, 2, 3, you're safe from ovarian cancer. Unfortunately, we don't have that. But ovarian cancer is prevented or rather seen less in women who've had at least one childbirth.
Okay.
Okay, who have been taking oral contraceptive pills for a certain duration in their life. Okay, who have breastfed their children. Now the logic behind all this is that all these women who've had a issue or who've breastfed or are on contraceptive pills, you're basically reducing the ovulation and the ovulatory time of the ovary.
Okay.
So the ovary has remained quiet for that much time, that many months, and that is the reason those women have a lesser chance of developing ovarian cancer. But just because that is the thing, you're not going to tell every woman, okay, now go get
Right,
pregnant.
it must also have some disadvantages.
It does, right? So if oral contraceptive pills are an advantage for ovarian cancer, a long-standing use of oral contraceptive pills can lead to breast cancer, can lead to cervical cancer. Long-standing use of oral contraceptive pills prevents ovarian cancer to a certain extent, prevents endometrial cancer. So it has its pros and cons.
Okay.
So basically, you need to talk to your physician, you need to talk to your gynec to know, whether the benefits actually outweigh the pros.
Right. And any tests associated with this particular cancer?
Unfortunately, we don't have a screening modality for ovarian cancer yet, where, for example, like a pap smear. Okay, a pap smear is an extremely good screening modality for cervical cancer. So every woman above the age of 30 is what we say, that at least above the age of 30, please go for a pap smear every year, so that God forbid if somebody has going to develop cervical cancer, we pick it up very early and we can help you. Ovarian cancer per se has no screening modality. It does have, like for example, a transvaginal or a transrectal examination when a woman does walk into our clinic, and if we do feel a mass on those examinations, that is the way we pick up a cancer. A routine sonography or a pelvic sonography done on a routine basis, a yearly basis, can pick up a mass in the ovary. There are tumor markers. Okay, so tumor markers are basically every cancer in the body comes with a tumor marker. You check that tumor marker, you know that that particular cancer is there, or how fulminant or how malignant. But ovary does come with its tumor marker. So you do have the CA125, which is the commonly used tumor marker. You have CA199, you have HEA. But the thing is, CA125 is also increased in other conditions like endometriosis, which is as commonly seen. It's extremely commonly seen. So you need to understand what level of CA125 is actually stands for ovarian cancer.
Okay.
But saying that, I am not going to ask every woman walking into my clinic ke har saal please do a CA125.
It is expensive also, right?
All tumor markers are expensive tests, but you don't ask a woman to do CA125 as a routine checkup. You do ask her to do a pap smear as a routine checkup because it's a very simple test to do. But CA125 is a tumor marker, it's a blood test. In that way, you will have a gastro coming and telling you that colon also gets detected late, so do an AFP also. You have various cancers in the body which get detected late and they have their own tumor markers. That way all of us can't combine and say, okay, do these 15-20 tumor markers. It's not feasible. But we do ask certain women who we may detect or we may feel that can get ovarian cancer in the future to keep doing certain tests like CA125.
I mean, as I researched, I think you get to know at later stage, maybe at stage 4 about this ovarian cancer.
Kinda, yes.
Right. So, like, how do you understand like how it spreads across the body then?
So the thing is, unfortunately, like I said, because it gets detected late, what we mean by detected late is we detect it when it becomes a mass and may have already spread to another organ.
Right.
We rarely, detect ovarian cancer, unfortunately, when it's still at its primary site, which is the ovary. We'll end up detecting it when the person comes to us with symptoms related to the lung or the liver or the pancreas or the kidney, which are the areas where an ovarian cancer can spread easily.
Okay.
Via the lymph nodes, via the blood vasculature and stuff like that. So when those symptoms come up is sometimes when you actually detect and say, oh, she did have CA ovary as the primary site.
Okay.
So, and CA ovary is detected, is mainly seen. So there are three types of CA ovary, okay, just to get it a little more medical. But out of those three types, the commonest one is the one that we see in the later age, between the ages of 55 to 64,
Okay.
approximately. Those are the women who actually come up with the commonest type of ovarian cancer. And the commonest type of ovarian cancer is the ovarian cancer which gets detected late.
Later. I think initial 6.5 years it takes for that cancer to get produced, but once it is developed, after that it spreads faster.
It spreads a little faster than
Right.
compared to other
Other
cancers,
cancers.
yes.
Okay, Dr. Tushna, tell me, is this ovarian cancer curable?
Curable, yes. Uh, when you say curable, ovarian cancer has its own modality of treatment. It does include surgery, it does include chemotherapy and radiotherapy. Obviously, it all depends on what stage have we caught the cancer and what is the best modality of treatment we can offer to that patient at that point of time.
Right.
So it does change, the permutation combination changes. But yes, if detected early, we can have a good curability.
So let's talk about even if it gets detected later stage, okay, so what is the survival rate for the patient?
So in ovarian cancer, we say the survival rate is approximately 60% of them do survive up to 3 years post-detection, sorry. And approximately 50% of them do survive to 5 years. So it's called the 5-year survival rate.
Oh.
So they do get, they do get detected early, and 50% of them can survive up to 5 years, which is for ovarian cancer good, not bad.
That's really terrible.
If detected early, yes.
Yeah. And with ovarian cancer, can a woman get pregnant?
So a woman getting pregnant, now the thing is, ovarian cancer means, does not mean that she's infertile, right? She could be fertile, her fertility could be good. But the problem with ovarian cancer is that most of the times the modality we do offer, if detected early, is removal of the ovaries along with all my other parts. Okay. Now very rarely, if the ovarian cancer is detected in only one ovary, do they offer treatment where we remove only that particular ovary and the surrounding structure, and we can think of conception in the future, but it's not as commonly seen. Another modality can be that if it is detected in the only in one ovary, you remove the other ovary, remove a tissue rather, ovarian tissue, and cryopreserve it. Okay, so that's called ovarian tissue cryopreservation. Like you have egg freezing and stuff like that. You do have ovarian tissue cryopreservation, where once that, so ovarian tissue cryopreservation is a very common modality which is used in other cancers. So if a woman is detected with another cancer, not ovarian CA, we do ovarian tissue cryopreservation, where once she is declared cancer free, we transplant that ovarian tissue back into her body, and can help her. Fertility maybe, but at least help her live a better quality of life, because the hormones start getting produced after a few years again in that transplanted tissue. When it comes to ovarian CA, the best modality if she survives and is detected cancer free is a surrogacy. Because we don't want to overstimulate the ovaries, we don't want to do anything, and we want to get everything in that area out. So we're not even having any microscopic spread. So surrogacy is the best option. But ovarian tissue cryopreservation maybe if it's only in one ovary, and maybe use those eggs. I don't know how science will take us ahead, but it could be a thing. Otherwise, surrogacy is what we offer such women.
Got it. And just a question from my side, like let's say a woman is pregnant and during pregnancy if she gets to know that she has a ovarian cancer,
CA.
then what next?
So, if ovarian CA does get detected in pregnancy, which is very, very, very unfortunate, but it does get detected, it depends on what stage of ovarian cancer she is and what weeks, how many weeks pregnant she is. So, if we feel that delivering that baby, once the baby reaches viability, which is 30 weeks or so, we deliver that baby, finish that whole pregnancy aspect, and then immediately deal with the ovarian CA.
Okay.
So that does happen.
I mean-
Women do get diagnosed with cancers when they are pregnant, in which case we do mostly try and complete the pregnancy course and then deal with their cancer later.
So generally having any type of cancer is anyway demotivating on it, or
Absolutely.
maybe depressing for everyone. So let's say you get a patient who is actually going through this ovarian cancer, then how do you help them mentally also, or what kind of support their families can give them?
So it's a complete holistic approach, right? Any person detected with any kind of cancer, malignant cancer, right, needs support mentally, physically, emotionally. The family requires similar kind of support. They need to understand what they are dealing with. So whichever cancer they are dealing with, but let's talk about if they are dealing with, unfortunately, any cancers related to my reproductive system, we first sit down and make them and their immediate family understand the whole protocol, that this is what is happening, this is the stage you're at, this is what we are thinking is the treatment protocol, this is how long it will last. Along with that, during the whole process, we do always involve a psychological counselor for the patient and for the caregivers.
Right.
Because they both need a different kind of help psychologically. So a psychological counselor is always on board. And cancer is not treated by one person alone. It's a multidisciplinary approach where you have an oncologist on board, where you have a person dealing with the radiotherapy on board. We all as doctors become one team.
Right.
And deal with that one patient. So the patient knows that everybody is in loop for everything.
Right. As I read somewhere, so with gynecologists, I think oncologists, the way you said,
Right.
it is very important to seek their help as well. So
Absolutely.
how they play an important role in this?
So oncologists are the ones who give the chemotherapy, which is required in cancer. Oncosurgeons are the ones who operate on cancers. Most of the gynacs are oncosurgeons also. We do operate on cancer related issues. So you do have in our field also doctors who have specialized only into oncosurgery. So they only deal with cancer related issues because the modality, the way they approach is very different and excellent. But everyone works as a team, the oncosurgeon, the oncologist, the radiotherapy if required. That all the doctors work together as a team when and where required depending on the cancer you're dealing with. So not all cancers require chemo and radio. Not all cancers can be operated on. So it's whether you have inoperable cancers, you have cancers where only chemo radio will work, you have cancers where all three will work, you have cancers where only surgery will work. So it's a permutation combination.
Okay. And any advice that you want to give it to their families as such?
So one advice which I always say every time I come on your thing is that doing a routine gynecological health checkup for every woman should be a priority. Every woman should undergo a normal routine gynac checkup every year after she has crossed 30.
Right.
Okay, so going and meeting your gynac, talking about your issues, allowing her to see your vaginal health, allowing the gynac to tell you what are the tests you need to do or may not need to do, when you should do them, what are the things you should be careful about, how your cycle should be. That from the gynac perspective is very important. In general, everyone should get a routine health checkup done on a yearly basis. It's not only, we normally see in our society that once you touch 40, 45, like I told you a few minutes back, is when you start doing your health checkups because you're like, oh, abhi, we are going towards the 40s or the 50s. No, you start your health checkups early. There is nothing wrong. Like
And
the
I think
biggest
there is
thing.
no age for
There's no
age factor
age.
associated
There's no
with it.
age. So the biggest thing that we say in medicine, right? Prevention is better than
Better
cure.
than-
So when we say do health checkups, I'm not telling you do the whole profile. Like do an MRI, do a PET scan. No. Do routine blood tests. Be in touch with your physician. For women, be in touch with your gynac. Just get a routine health checkup done on a yearly basis once you cross 25, 30. Because in today's day and age, the stress we are going through, the emotional, physical, mental stress you're going through is very different than what our grandparents did. And the lifestyle is different, the environmental factors are different. So we need to work hand in hand with that.
Thanks for that advice, Dr. Tushna. But I think all these, reels and readily available information over the internet, I think people are reading or misreading the information.
True.
Right? And maybe they are following what is convenient to them, or maybe which is freely available and not going to the gynac or maybe physician regularly, right? So yesterday I was discussing the same thing with my friend, one of my friends, and I just asked her, "What do you know about ovarian cancer?" So she was like, "Okay, I know this," and later I understood that she's actually talking about cervical cancer, right? And I just told her, "Do one thing, tomorrow come over and let's understand how good you are reading or well you are reading about it." So in our Swanky POV segment, I would like to call Priyanka for that. Hi Priyanka.
Hello.
Welcome to our show.
Thank you.
Okay, so I just told her yesterday we were talking about ovarian cancer, right?
Right, yes. So it was a complete blunder, okay. Right now, everyone is only talking about cervical cancer. And he randomly called me and he was like, "Do you know anything about ovarian cancer?" And I gave him all the symptoms that I've read on internet or maybe what I've grabbed from internet. I gave him and he took it. And he's like, "Okay, come office tomorrow, we'll discuss about it more." And then I realized maybe I spoke something which is not right. And imagine if it wasn't him and I'm giving the same thing to
Somebody else.
who doesn't have knowledge not on cervical nor on ovarian cancer. And I'm like, okay, I've goofed it up. And obviously this morning I'm here to correct. And I'm really glad that I got to hear a lot of things from you.
Thank you.
But I have still more questions.
Tell me.
For me, I feel right now since internet has so much of exposure and there are really good content creators. I mean the
True.
doctors who are creating
True.
the content. It is just about whom you're following right now.
Absolutely.
But people only listen or they just watch what is there. I don't think that rate of people or a woman especially want to visit a gynaec until unless there is
It's
an
not
issue.
as much.
Yes, and they are facing some sort of issue.
True.
And I think with teens, they don't even want to watch this content. Like the teenagers who are girls who are like 16, they have already started getting their periods. They are into a physical intimacy also.
Absolutely.
They don't know much of the information and they wouldn't even watch this content. There are very few set of people who will watch it.
Right.
So I think that gap is yet
There.
to be filled. And what do you have a say on that? Like as a me, like I have a lot of nieces and they are now growing up.
Correct.
What kind of a information or what kind of a conversation I can have with them, or what is the knowledge they should have and know
Regarding gynac health, right?
gynaec health.
So, like I tell all the patients who walk into my clinic, whether they are mothers, grandmothers, or in their 20s, what we do is we tell them everything related to all the issues they can have. And before they leave, they're always told, ki, please, if you have nieces, nephews, give them that information. Now, fortunately, unfortunately, however you take it, in today's day and age, there are some of us who are extremely vocal when we talk, have a very open conversation in our household. But at the same time, you do have these families where speaking about periods is
Also
yet a
kind
taboo.
of a taboo. Yes.
Absolutely. You cannot, you cannot get up and say, I got my period. They'll have all the funny and weird names for it, but they won't call it a period or a menstrual cycle or a jump, whatever it is. And having open conversations has always been my mantra. Have open conversations. Explain to your nieces, nephews, children regarding period health. what it is that you need to look out for. But even the boys, not just the girls, because like I was telling Tushar last
And I
time.
was just going to add on to that only
Correct.
that we had that episode of like how decoding women's health for a
For
guide
a
to
man.
men, right?
Right.
So, for ovarian cancer also, I wanted to ask you like what men should know about it in detail.
It's not about only men wanting to know, but everyone knowing. You can't really know about ovarian cancer, or you can't really know about any cancer per se of the body. What you need to know is if something goes off, don't just read on Google and say, Google is saying ye ho sakta hai.
Yes.
Or you read somewhere, or you heard some person on Insta, or
The most of the teens that I've seen, they will first go to the Google.
Yeah, so you'll always go to Google.
Yes.
It's not wrong. Google does give you a lot of information, but if something is off, meet your doctor,
Right.
whoever it is, whoever you're comfortable with. If something is not wrong, yet see to it that you meet your doctor on a yearly basis. Starting this education in schools, super important, like we spoke.
Yes.
And not only saying this is a period, this is how you get it, this is how you wear a pad. No, you need
Because
to.
that was the knowledge that all I had.
All
in
of us
my
got, I
school.
agree.
I think it's now.
It has.
It
Sexual
has-
education has started in
Yes.
a proper way. Menstrual hygiene education for both boys and girls. I keep harping, please let the boys know what the girls go
Yes,
through.
because since I know in my times, I mean our times, they used to have separate rooms for boys and girls,
Girls,
and
yes.
guys will also only know about the men's reproductive system and otherwise.
But it doesn't make sense.
Right.
It
You
doesn't
should
make
actually
sense.
know other way so
Other
that you
way.
can understand each other
True.
better.
Correct.
True.
Correct. And one more thing I wanted to know, like there is, I'm not sure if this is a myth. I would want you to talk about cyst because this is a very
Ovarian
combination.
cyst?
Yes, and I think it's the very first sign could be this because if I Google it, if I have a cyst, it just talks
Ovarian
about the cancer.
Cancer.
But it could be that it is just a cyst.
Exactly. So like I'm sorry for whoever out there is from Google, but the first thing I say is that Google does give you a lot of information, a lot of good information, but it gives you also the worst information.
Right.
Right? So if you Google anything, it is going to show you cancer of that thing because it can cause cancer. They are not wrong at all. But not every ovarian cyst is cancer. Ovarian cysts are very routine things seen in women. It depends on what cyst I'm seeing. I'm seeing a follicular cyst, I'm seeing a simple cyst, I'm seeing a complex cyst. What kind of complex cyst? Everything changes the way I treat you, the modality I offer to you. Whether I tell you, you know what, do nothing, sit on it, repeat a sonography after 2 months and that cyst will not be there. Or you know what, for this I will need to give you ABC medicines. Take these medicines, repeat the sonography 3-4 months later and that cyst may not be there. Or this cyst requires a surgical intervention.
Okay.
You know.
So, but for cyst, there is a surgical process.
Certain cysts, yes.
If
Not
it
all.
grows, right, abnormal.
Complex cysts, certain kind of complex cysts like dermoids and all do require a surgical intervention. Endometriotic cysts at a certain point of time could require a surgical intervention. Certain simple cysts which are not responding to any kind of treatment after some time can require a surgical intervention. But a lot of my cysts actually are going to just dissolve with a little bit of medical treatment and you're sorted.
And
Okay.
since yesterday, that was a confusion that cervical cancer and
Yes.
ovarian cancer.
These are two different, very different
Yeah.
things.
Organs of the
Organs.
woman's
Yes.
body.
But I really
Yes.
want you to also highlight about it so that people know because they are really close, close organs to each other.
Close organs, but very apart and
Yeah.
very different.
True. So cervical cancer came into the news, we all know.
Yes.
And for the good, let's say. So cervix is a part of the uterus, it's the mouth of the uterus as we call it. Cervical cancer is very, very common compared to ovarian cancer. But the best part about cervical cancer is that it can be detected early. You can detect it early and you can prevent it to a large extent. So cervical cancer is caused by the HPV virus and you do have the HPV vaccine in the market, whichever one you want to choose, which can help you prevent cervical cancer if taken at the right time, right dosage, right everything, to a very large extent. Saying that, a pap smear that we just spoke about earlier can detect cervical cancer much before it actually can hit you. So I can have certain changes telling me that this woman could get cervical cancer in the future. So I, as her, physician, am more aware. I keep her more aware. We do certain extra tests. So cervical cancer can be detected, prevented, and hence it's better.
Coming back to cervical cancer, there are vaccines available.
True.
Lot of people are saying, I mean, at least my gynec told me that you should take your vaccine when you are actually on your periods. How true it is that it should be taken while you are on your periods? And what difference does it make?
Very frankly, to the best of my knowledge, it really doesn't matter.
It doesn't.
Okay. You should take the vaccine.
Irrespective.
Period.
Okay.
You should. Okay. You take it on your periods, you take it after your periods, it's fine.
Fine. Okay.
But take the vaccine.
And also, there are many variants available in the
Absolutely.
vaccine. If you could tell me more on that.
So there are a lot of companies which have come out with the vaccine. There was the most talked about vaccine today is Gardasil 9, right? So what Gardasil 9 has is it has protection against 9 variants of the virus which can cause cancer. Gardasil 9 is entered the market. Has entered the market recently. Recently means around 3-4 years back, if I'm not wrong. And it is one of the best vaccines to take. Yes, it is expensive, but it is not bad. You do have other brands also which are in the market. You have the Indian brand now, Summarising, which is in the market. Whatever suits you, whatever you understand about the vaccine, what your physician or your gynec can tell you about the vaccine, and whatever matches your whole concept is fine, but take the vaccine.
Take the vaccine.
Because it does protect you. The earlier you take the vaccine, the higher the protection level.
Okay.
So we do say that we give the vaccine between the ages of 10 to 45. The earlier you take it, like before 16, that vaccine is only in 2 doses.
Okay.
After 16, you're going to have 3 doses of the vaccine. But take it. There is no downside to taking the vaccine.
And there is no any as such research that it will do anything bad to you, because I think
It's been around for years.
but there is no more,
Gardasil 9 has entered now, but
Okay.
Gardasil 4, Gardasil 6 has been there for years. We all have taken it.
Okay.
Right? Vaccines have been there all for everything. Like right now, a BCG or a polio vaccine, you have to give it to your kid. You have no choice. It's a part of the schedule. The government is trying to get the HPV vaccine also part of the schedule. If it does happen, then great. We are also saying to give the vaccine to the boys, because the logic is it's not a cervical cancer vaccine, it's an HPV vaccine.
HPV vaccine.
And HPV as a virus can cause cervical cancer, can cause penile cancers, can cause anal cancers, can cause HFN cancers, that is head, face, neck cancers of certain kinds. So by taking the vaccine, you're actually preventing yourself to the best of its ability against all these cancers. So why only women?
Okay, correct. Men's
Boy-
are
men too,
important.
boys
yeah,
too.
boys too.
Boys
And I think when they start, it should start for boys and girls.
It has. In
Okay.
certain schools and stuff, they already have started propagating it, but boys and girls, yes.
I had a very wage discussion this with my friends and who are a little elder to me, and they just shoo me away like, we don't need this vaccine. And
Because
that-
it's an option, right?
yeah.
So whenever you give an option to somebody कि आप ले सकते हो या नहीं ले सकते, it's you have so much content out there which is pro and against the
Correct.
vaccine, like pro and against a lot of things in the market,
Correct.
right? There is always a good, there is always a bad, but like you always say, you weigh the pros against the cons. It is better to take the vaccine.
Okay. Yeah. Now to sum up this ovarian cancer, coming back to that main topic of ours. So can you give us some healthy tips to make our ovaries healthy?
Wow. Okay. So healthy tips to make the ovaries healthy per se is to have a healthy mind and body is going to keep all the organs in your body healthy. So leading a healthy lifestyle, trying and incorporating exercise, yoga as a part of your daily routine at least 4 times a week, if not more. Eating healthy at least again 4 to 5 times a week. That doesn't mean stop eating chips, stop eating pizza, stop eating burger. It's not the correct thing to do if you're going to tell your body to stop eating ABC for a long duration of time. So eat it, but eat it in moderation. Don't eat it. Don't eat fried. Don't eat refined flour on a daily basis. Eat it twice a week, maybe that's fine. But whatever do in moderation. We are living a different lifestyle compared to what our parents and grandparents did. We are under different kind of stresses compared
And
to
with a different kind of weather
environment,
and environment
right?
altogether.
The heat wave is going on.
Exactly. So everything is changing around us. So also listening to what they say, we didn't need to do this, we didn't do that, we didn't do that, is they didn't have to face ABC that we are facing. But overall, to sum it, just be healthy, have healthy conversations, be mentally healthy, be emotionally healthy, be emotionally available for the people around you. That's it. Being healthy overall is going to make my ovaries healthy too.
I think that's why I said while asking you that our ovaries, because it is not something, an organ which is only related to women. It is
True.
going to take care of everyone.
Absolutely.
So
Absolutely.
thank you so much for
Thank you,
this.
Tushna, for having me, and thank you, Priyanka.
Thank you so much. It
for
was a
this
really
question.
insightful information.
I'm glad.
And I'm sure, of course, we don't have any medicine or any screening yet, but of course, good luck to all those people who are trying for
Trying
it.
and doing the
Absolutely.
research. Yes.
Absolutely.
Yeah.
Thank you.
Thank you.
Thank you.